Oxygen desaturation in infants during medical transport. Understanding oxygen saturation level.
Research has shown that about 90% of the oxygen in our alveoli makes it to the blood. So for the sake of neat mathematics, if the pressure of oxygen at sea level in the healthy alveoli is around 110 millimeters of mercury, the partial pressure of oxygen in the blood will be just under 100 millimeters of mercury, 90% of 110. And this is called the alveolar arterial gradient, or the AA gradient. It can be measured and provides a useful picture of the health of the lungs. Diseased, old, or damaged alveoli tend to let less oxygen diffuse into the bloodstream, and this is reflected in a rising AA gradient. The normal value for the partial pressure of oxygen at sea level is around 80 to 100 millimeters of mercury. But something interesting happens as it approaches 60 millimeters of mercury. At this level, oxygen has a hard time binding to the red blood cells and levels can fall to a dangerous point. This relationship is described in the beautiful oxygen dissociation curve. What this says is that at levels of partial pressure of oxygen less than 60 millimeters of mercury, the oxygen content of hemoglobin falls precipitously. From the physiological perspective, this is grave indeed. Thus, looking at the curve, we can see that a partial pressure of oxygen of 100 millimeters of mercury is much better than a partial pressure of oxygen of 80, even though the oxygen saturations will not change much. Of course, there are many factors that will change these relationships. Supplemental oxygen, high flow oxygen masks for instance, breathing oxygen poor air at high altitudes, or diseased lung, the variables are quite considerable. Here are the normal values for an arterial blood gas.
Pulse oximetry on infant.
Important that you take a few seconds to prepare before you start. Be sure to wash your hands. Make sure that the oximeter cable and probe are clean. Check the patient's band to be sure you have the correct infant and that the infant is at least 24 hours old. Make sure the infant is calm and warm, but not in a deep sleep. Remove the probe from the package. Wrap the probe around the infant's right hand or wrist. Connect the probe to the oximeter. Turn on the pulse oximeter. Swaddle and calm the infant. Observe the oxygen saturation numbers on the monitor. Make sure there is a pleth waveform that correlates to the infant's heart rate. These are the preductal readings. Remove the probe from
Background. Premature and term infants frequently require aeromedical transport. Little is known about oxygenation and safety during flying infants less 6 months. Current guidelines recommended avoidance of air travel for infants younger than 1 week of age and avoidance of ascents to moderate to high altitude until 6 weeks of age in heavily full-term infants. Increased risk of hypoxemia. Those who have this condition are preterm infants, those with respiratory disease, not in heavily full-term infants who are older than 6 months of age. Article aims. There is an article that reports the findings of a study which examines the effect of hypoxia during aeromedical transport in infants younger than 6 months of age. Methods. Oxygen saturation in infants less than 6 months of age was measured by means of continuous pulse oximetry during aeromedical transport from January 2010 through December 2011 to define the incidence of saturation. Aeromedical transportation helicopter. A total of 112 normothermic infants without evidence of carbon monoxide poisoning were transported by means of fixed-wing aircraft or helicopter. The median age was 3.5 days. The median postmenstrual age was 38 weeks and the median flight duration was 48 minutes. Results. And finally, no serious critical adverse events were observed and oxygen therapy was the only intervention required. In this article, they observed an association between lower in-flight SpO2 and higher CPA. SpO2 normalized to 94% or more with oxygen supplementation or upon descent to a lower cabin pressure altitude. The conclusion. The saturation were observed in about 1/3 of infants younger than 6 months of age. Their data do not seem to support current recommendations to daily infants air travels until 6 weeks of age on the basis of oxygen saturation. More in situ studies are warranted to examine the effect of flight in sick and elderly infants. Thank you.